Glad she could be with us again. It's Monday night, which means it's 4, 9 plus me. Good to have you. Hello, everyone. Scott Mitchell. It's Watch Oklahoma. Not COVID Watch Oklahoma. I was reminded an hour or so ago because we're going to talk about something else. I think we should. Hopefully we can. By the way, good evening, doctors. Dr. Chansholm appears courtesy tonight of LLP. So good to have you here.
Polo.
Oh, it's Polo.
Obviously an LLB ripoff, but still
that's it's a good looking shirt. I'll trade you my
warm
for yours.
Warm.
It's warm stuff. Dr. Sublett, Dr. Armitage, Dr. Chansone back with us. I wanted to read last year's headline. Did I read you a year ago today what the headline was? Mm-hmm. CDC warns America, do not travel for Thanksgiving.
Yeah.
Well.
And now it's American Airlines warning people not to travel.
Hey, can I tell you one other thing before I turn it over to you? Because you guys have got a lot to talk about tonight. We're going to probably end up about 45 tonight. Some bouncing lights around here. So I looked up this week. I don't have my flu shot, so I went and I asked one of my buddies at City County. They said, go to Vax OKC. Mm-hmm. So I just did the Vax. Oklahoma City now has the drive-through facility, over here on 63rd. Mm-hmm. So I went to OKC Vax. I filled the thing out. It was so incredibly simple. Drop down, Phil Maytubby, Patrick McGough, for those guys over there. It was awesome. And by the way, if you haven't seen the building, doctors, you haven't seen the drive-through facility, just in time for our next epidemic, pandemic, whatever it's going to be. It's a great facility over there. You drive through. I can drive through. I can, blow out the glass packs if I want to. Because I had board meeting the other day. I wanted to ask who had burned rubber in that one. They have it. I want to try to do that tomorrow. Probably get penalized, but what the heck, right? Season of giving.
Yeah, there you go.
So anyway, vaxokc.com. If you haven't got your flu shot, boom, right there. Well, what's our topic tonight, doctors? It's everybody's about to travel, and I saw today 95%, almost 98% of TSA workers, but the ones that haven't gotten the vaccine, they're not going to fire them. They're going to counsel them. Federal workers, 95%. Even before the mandate goes into effect, Biden's winning on this. Agree or disagree?
I'm sorry, even before, what did you say there?
I say even before the mandate kicks in officially January the 4th, the president's winning on this. So federal workers are almost there.
Yeah. Yes. He's made progress. Yeah.
Yes. I mean, I wouldn't say the ends justify the means necessarily. I mean, I've never been a fan of mandates, but more vaccination is better. I mean, I think that I'm encouraged by the fact that people, but the second part of that you said just at the end there, Scott, is, that they're counseling the people who haven't done it yet. And there are some people who are just not going to be able to get over the hump, but counseling people, continuing to educate, you hope that eventually that kind of breaks through, that people start to see that there's some rationale behind sort of the things you're saying. But, lots of mandates to kind of say, hey, if you want to keep your job, you need to do this. I mean, they're doing it in lots of industries. The federal government is one of them, but they're doing it in lots of other ones too. So,
I guess, way back at the beginning, we were talking about herd immunity and what those numbers were. Clearly 98 and 95% were way overshooting what the original concepts were. Have you heard any good numbers on what actually is the goal?
So the way you calculate herd immunity is always R naught minus 1 over R naught. And so it depends on how infectious the organism is that you're talking about. So when you talked about the first iteration of COVID, the R naught of the organism was 3. So 3 minus 1 over 3, 2 over 3 is 66.7%, right? Whereas Delta variant, because it was so much more infectious, they have an R naught of about 6 for Delta variant. So 6 minus 1 over 6, that's 5 over 6. That's about what? My math is 83.3. Is that what it is? I mean, okay. Measles, the R naught of 10 minus 1 over 10 is, way higher. So here's the thing, though. The next question has to become, what does immunity really mean? Because clearly some people who are quote unquote immune can still get COVID. And I think that part of the misinformation that has been transmitted is that vaccination should keep you from getting COVID. Again, we have to continue to say it may not keep you from getting it, but it will keep you from dying from it. And or having serious complications from it for the most part. Are there breakthroughs? Of course there are. And that's tragic and sad and awful. But you want to stack the deck in your favor as much as you can. Every now and then someone draws an ace at the end. And so you want to stack the deck in your favor as much as you can. The way to do that is through vaccination and through herd immunity yourself the best you can. Going out and getting COVID is not a good strategy. But maybe we'll need more to keep it from totally circulating. We've talked many times on this show about how it's never probably going to quit circulating entirely, right? I mean, it's always going to be endemic on some level. I think we're probably going to see a little spike in cases here, but I don't think we'll get back to what we were.
Yeah, it just struck me that, we're chasing a lot of probably good behaviors without necessarily firm rationale, firm constructs anymore. And so many things have been thrown out over the last 2 years. It would almost serve us to have a little bit of a reboot and say, well, here's where, we think herd immunity is. Or, interestingly, we had a report of more deaths from COVID in 2021 than 2020. Now, that's probably a function of the Delta virus and the continuing, penetration into the unvaccinated early on in the year, et cetera. But if you're talking about statistics that really matter, that's underplayed in my estimation. That's a incredibly powerful marker. And here we are in the second year, and let's explain it. Let's get out the pros and cons of how we ended up with more deaths in 21 than. And clearly at the beginning, your caseload is low because your exposure is low. It's on an exponential curve. But, again, that's a really important statistic to understand and let people chew on. Otherwise, you read that and you're like, wow, that doesn't look like the right direction.
Mm-hmm.
So are there some groups that are putting out data at this point, or are we seeing anything, guys, into adult level? Children
as far as why the mortalities or why there were more mortalities in 21. I mean, I think a lot of it has to do with, we started the infections, the vaccines on December 15th in Oklahoma, and that was pretty much consistent with the rest of the country. I mean, nobody was within 2 or 3 days of each other. Yeah. And really, it wasn't widely rolled out until April. We didn't really have the Delta variant start to surge until May, June. Is that am I wrong on that number? Yeah. I mean, that was kind of where we started to see it come in. But I think, although it's the same disease, I really think you could count Alpha variant and the original wild type, the B612 variant, as almost different than the Delta variant. I was talking with a pulmonologist today, who's a good friend of mine, who's an excellent pulmonologist down in the South Side, Dr. Paracha, and we were talking about how different Delta variant is than the Alpha variant, even than the variant Alpha and then the wild type variant. How different it is, and how much more deadly it is just this time around. I mean, I was asking him, I said, what do you think your chances of mortality are if you're intubated? He said, I don't know, 70-80%. I said, yeah, I kind of agree. I mean, this time, and that's not what it was the first time around. It was probably 30 or 40%. Now, do I have hard data to back that up? No. But the bottom line is, I think that in 2021, we almost dealt with a different disease than we did in 2020, John. And I think that has been part of that statistical soup is if you have something that's 3 times more fatal, you're going to have even 1.5 times more mortality despite vaccination, just because of the nature of the disease. Mm-hmm.
Well, you've articulated some great rationale there, and you got me hooked, but I didn't see it in publication. So, I think that's what we're missing here. We're missing the little bit of extra depth to the reporting, the little bit of extra knowledge that when you start talking about lethality and really important elements of the biology that we're talking about here, that stuff gets very little play, even when it's relevant, even when it should be piped into the conversation and the public brought along to that understanding through really important findings, important statistics, and important understanding. Again, you just articulated it great, but I know we have a lot of listeners, but
prove
I'm
it.
not sure
I
we
can't
moved
prove
the
anything
needle
I
too
just
far.
Mhm.
So, anyway, so I think that's harkens back to a lot of the conversation about what are the goals, what are the, how do we explain important new findings in a way that carries us all together in understanding it, rather than somebody ricocheting off with the raw fact, it's more fatal this year. Well, I know that the steps are immeasurably stronger in terms of treatment and prevention. 2021 has been a grinding year, but has probably been a successful year for us in terms of upping our game. But you just look at that number, and somebody could grandstand with that, or pervert that number into something else pretty easily.
Mm-hmm.
There's a headline from 31 minutes ago. Let you guys tell me about this one. Oklahoma City Thunder ending COVID requirements for fans.
I saw that.
Here's what it says.
Ending COVID requirements for
This
attendance.
Here's the headline. Here's the first paragraph. This is AP. Oklahoma City Thunder announced Monday that beginning December 1, fans attending games in person will no longer be required to provide proof of COVID-19 vaccination or a negative coronavirus test. The quote is, "We've decided to lift our vaccine testing requirements, citing a decline in coronavirus cases, increase in COVID vaccinations in Oklahoma County." And the quote goes on to say, doesn't say what it said the statement, but it's in quotes here, so it's official. It says, "Since we announced the protocols in September, the Oklahoma Department of Health reports the percentage of Oklahoma County residents 12 and older." It's probably the Oklahoma City County Health Department, but nonetheless, Oklahoma Department of Health is what this is, but this would be OCCHD information. Not that I'm
So is the headline there that the
85%
spread?
Yeah, maybe.
I mean, it's kind of crazy that they would do that when we've seen a week of increasing 7-day rolling averages, because we were down to like 530, 580, something like that.
Mm-hmm.
Now I think we're back to 840 or something.
825.
On the 7-day rolling average. I mean, poor time. Sounds like they had something crafted for a while and said, "Oh, we better get it out there before it gets to 1,000." But here's the thing. I mean, we have learned this in the hospitals. When you walk something back, good luck trying to re-implement it.
Mm-hmm.
So I mean, if the gloves are off with the Thunder and the vaccinations and everything like that, it's not coming back. I mean, there's no way they're going to put that genie back in the bottle.
Are you calling it this? You can try to walk it back.
No.
I
think that I think it's not a hill worth dying on. The Thunder are playing well. They want more people in the stands, playing well for what we expected. Let's just say it that way. I mean, we're not the Warriors, but Thunder are playing well. They got some excitement behind it. Probably their vendors are clamoring for more people at the games, and I can tell you, I've got season tickets. I love going to the Thunder games. I'm a huge supporter. Have been since the day showed up, but I can't. Sometimes it's difficult. I gave away some tickets, and somebody told me, they said, "I can't find anybody to go with me because they're not vaccinated." I mean, the concessionaires are going to complain about that after a while.
And I think it's interesting because a lot of times the business or the employer or an agent that really isn't a public health agent is put in a position of kind of helping push forward the vaccinations or put forward some of the better behaviors and encourage those. But that's really if I'm the Thunder, COVID's not COVID is a risk, obviously, of doing business in terms of being a spreader venue. But when you look at certainly football games have had now they're outdoors, admittedly, but still the Thunder's kind of on a bit of an island when it comes to the rigor with which they're approaching, their previously
I
their
think there
policy.
Are plenty of NBA venues that aren't doing that, so that it's not like they're by themselves doing that. Now, I as I recall, though, Scott, I believe that same statement said that the courtside restrictions remain because that was an NBA Players Association requirement that courtside. So Dwight, when you go to the games in your fancy seats, you'll still have to wear a mask.
Oh yeah.
Ron and I will be
There you
free
go.
to
There
drink
you
our
go.
beers unfettered. But
Well, when you
The
said
ones
that
we
there are
use
other
binoculars.
NBA teams that are enforcing it, every market is local. I mean,
Right.
when I was out in Oregon, there was a lot of concern, a lot of mask wearing, just a different mentality. And I can see that, although I didn't have tickets to the Trailblazers or anything like that, but it's easier for them to fit into their local context than I would imagine it is for the Thunder, where the Thunder's position is a little bit stronger than the
I can promise you, in
background.
Houston and Dallas and San Antonio, it's probably the same thing, right? I don't think they required vaccination status proof before they came into the games there. In New York, they've been doing it since before it was cool, right? I mean, they were requiring vaccine presentation at the Yankees and Mets games back in May. I mean, a long time ago, So I mean, it's there are some places that have been doing it a lot longer.
It would be nice if we had some way for the State Medical Association or the County Medical Society to acknowledge, the Thunder was trying to aggressively position a lot of good behaviors, encourage folks, just like those employers that have stepped up and, mandated or encouraged through bonuses or whatever it is. But, I think it's in the interest of the public health authorities to look around and see who was, pulling on an oar and do something for those folks, acknowledge them, because a lot of those decisions, there was no great roadmap, and a lot of people did a lot of inventive things and helpful things. And I guess if we ever have that other pandemic that we've now got the drive-throughs for, we better have a game plan that says, hey, the Thunder were a really strong supporter of some really great measures, and let's let them know that we noticed. Again, I don't know which authority. Maybe it's us. Maybe we need to pass the hat on this show and give them an award. But somebody should be doing it. I don't know who that. Anybody got an idea on who should be taking that role of cheerleading and
Oklahoma State Department of Health. OCHD. Hell, they're in Oklahoma County.
Yeah.
I mean.
Well, they're just basically putting it in the laps of the patrons now and saying, hey, that's the way it is pretty much around town, or most venues at this point. Is there's things have gotten more lax, which emphasizes the point about vaccine. You need to you've got to protect yourself, and I think the Thunder has done a great job.
Couldn't you argue that they've had the most stringent policy of a private business anywhere in Oklahoma? I mean, they were. I went to several. I've been to several Thunder games this year. I always have to pull out my vaccination card and walk in. Now, I'm not sure how many other places I've been that have done that. I mean, I've been to some places that you have to kind of attest that you've done it or whatever. But of all the private businesses, they've probably been the most aggressive.
I'm sitting here kind of feeling ashamed that I don't know who else belongs on the list.
Well, the theater.
There were some concert venues up in Tulsa, right? When Green Day came through and did their concert, I think there was a country show who did their concert.
Canes was still doing it a couple of weeks ago.
What was the restaurant? What was the restaurant downtown that did it off the bat, Scott? Remember we talked about it on the show. Was it Runside?
Yeah. Well, the Broadway production.
It was Ludivine that required
Lyric,
and I love Ludivine, by the way.
Lyric and Broadway, those things have been pretty stringent on it up to this point. But I don't know if that's going to continue or not. But that would be in one other group I think of. So.
Yeah, we went to Ludivine right after they announced that. Candace said, I feel my freedom right now from people who don't have the vaccine. So it's just, who knows. By the way, the answer is every restaurant in Los Angeles County 2 weeks ago, everywhere we went, we had to pull out the card or on the phone. They took it on the phone, but just basically every place in California. So there was a study, Dr. Sublett, I just sent you a text a few minutes ago. There was a story at 6 o'clock of some kids in Texas. Yeah. And I remember after my grandbaby was born, we wore masks because of RSV, and I had people who were giving me grief over it. I said, you're vaccinated for COVID. I said, it's
Mhm.
RSV. And so people hadn't heard of that when they were being silly and not bright because they hadn't heard of it. But it's a serious thing that's going around, Dr.
Oh yeah, I think it's I just caught that too just before the show about it's a human metapneumovirus, and kids are hospitalized down in Texas, and there's some indication that there's the units here in the state are full, but they haven't gotten any feedback from the hospitals or anything. I don't know where we are on that. I haven't heard any big things. I don't know if you've heard anything, David, in that regard, but no, that's the first I've heard of this. I'm going to do some more checking tomorrow for sure, see what's going on with it. But yeah, masking is good for a whole lot of viruses. You know,
Oh, yeah.
even
There's
if you got a
great
common
study that
cold,
came
you know,
out.
it's not a bad idea to put a mask on, or you know, if you're in that setting or during the flu season. There's no saying says that you just do it for COVID. I mean, it protects against a lot of risk.
We proved it last year, didn't we? Though, I mean, you know,
Yeah.
with the flu season that we had last year,
Absolutely.
masking clearly works. I mean, I think
Yeah.
I'm pulling up. Where's this? This is from the British Medical Journal, and they talked about the effectiveness of masking and how big of a difference it made in British Medical Journal. I pulled this article yesterday about how big of an impact it made on transmission of disease. I mean, it's not insignificant. So people who sit there and poo-poo it and everything like oh, I can see my breath around it and everything. Yeah, okay, you can see your breath around it maybe because you ate, you know, bad food, but it doesn't have anything to do with the transmission of disease. And it has been clearly shown that masks make a difference on that. As we continue to de-escalate from that, it stands to reason as we continue to do other things that improve the efficiency of transmission of disease. Go out, congregate in houses in the cold. You know, that's why viruses are always winter, right? It's not because of the cold weather. It's because we stay outdoors, we stay inside. We'll see this year as kind of, you know, some of those safeguards that were touted so aggressively last year. I mean, you know, last year, think about what the CDC was saying last year at Thanksgiving. Stay with your nuclear family. Don't be with anybody else you haven't been with, you know, for the last, you know, whatever. Whereas
ventilate your turkey.
Whereas this year, you know, they're like, hey, enjoy it with your family and everything like that.
Yeah.
They still obviously really tout vaccination as they should. But I mean, it'll be curious to see how much more of the RSVs. Maybe there's another adenovirus outbreak with the D40.
Yeah.
Maybe there's another flu outbreak. I mean, who knows? I mean, because, you know, we talked about last week how endemic the flu has become in certain places. I mean, it could be a very interesting year, not necessarily in COVID, just everything else. And then, God forbid, you start backing them up.
Isn't there an uptick in flu? I'm hearing some news about that. Is that what are we seeing this week? That has jumped some here in the state, has it not?
I haven't looked at the flu view this week.
I saw something on it that we were up fairly high in the rankings nationally.
Yeah,
that may, I don't know. I
better flu than football? Maybe not.
Well, I don't know about that.
According to the CDC, New Mexico's burning up with flu. We're looking at their map.
Yeah. New Mexico's really going. And then there was an outbreak, I think, in Michigan, Lansing or something up in that area too. But I just didn't know if we were seeing much.
How about this? Since September 1st, 2021, 65 flu-associated deaths in Oklahoma.
Wow.
Didn't we only have like 10 last year?
Yeah.
The whole year? That's crazy.
Yeah. But you know it's going to be higher. It's got to be higher. Yeah.
So I have a question on the masking and I guess also on the staying 6 feet apart. You know, those are never going to be bad suggestions. I mean, so how do you pull back from that? You know, I'd love to see us go to 5 feet. You know, that would just be cozier, wouldn't it?
Would it? Just make all the difference in the world.
Seriously, you know, I'm being facetious there a tiny bit, but seriously, when does it become acceptable to reconfigure all those public spaces that have separation and have you know, a lot of measures that were based on, you know, largely, you know, it wasn't deep science, that's for sure, that got you to 6 feet. So, where's the off ramp? Who's talking about how to get us to a reasonable endpoint that says we should do that? Because otherwise you're never going to get somebody going, oh, well, what, let's go nuts. Let's take a risk. Let's get to 3 feet, same with masks. Who's going to be the person who steps up and says, okay, masks are over?
Well, I would submit to you in some societies, masks never went out of style. I mean,
Sure.
In Asia, I mean, we still see plenty of that. I think there are going to be people that wear masks for a long, 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 long time. Whether or not it's okay or not okay, I mean, I think it's going to be the same speak that we've heard the entire time, right, Sean? It's going to be assess your individual risk status and whether or not it's the right thing to do for you and all that kind of stuff. Which is probably good advice.
But if you default to that, then you have basically said that you're not in a position to make clear statements on other matters, right? So by not having a definitive statement and saying, choose your own path, and then we complain when people choose their own paths on other things, to me, it's part of the same concept of come up with clear guidance. If you want people to follow you, I went to the CDC site earlier today to try and understand the logic behind the booster at 50 years old. They were saying you should if you're over 50, and if you're over 18 and you have you're in a high exposure environment, then you should have a booster as well. But there wasn't a lot of data there that really said how they got to 50 years old. And again, that to me, that communication and that pull as many people who want to get information from you, give them the easy pathway to say, here's how we calculated it from 5 studies, and here was the average age of the cutoffs, and that's why it's 50. But the same thing holds with masks and with social distancing. If you don't articulate what it is you think we should be doing, people are going to fill that gap with their own logic, and they're going to extend that same luxury to more important things. So, I guess it's not all or nothing, but it's certainly a game plan that you have to address these various elements. Everybody asked us to do this at the beginning of COVID, right? So they took this as a statement of protection. Don't they kind of owe it to say what is the unraveling of their previous statement, not just let you sort of fade off into some sort of baseline consensus? I don't know. I think they owe us. I think they owe us an explanation of what their thinking is.
I don't disagree. More information is better information, but they've got a lot to learn about communication too. And I think that it's lots of different things. It's, sometimes there's not a hard and fast number of why this age, not this age. I think there's lots of different data points that go into that, but I don't disagree that some, normally they do that, honestly, John. When you look at, vaccination recommendations for pneumococcus, something that I'm thinking about that's changed a lot over the last 10 years. It seems like every time I turn around, we got a new vaccination recommendation. They will put down their references of why they think a certain thing. But I was looking at that, and they didn't do it in this case. And so I'm sure they're there somewhere, but it's like, really, why are you thinking this way? And maybe that's not okay for, everyone to look at, but certainly as healthcare professionals, we need to understand why people are looking at it that way.
Well, when you think about, sorry to harken back to the social distancing, but I know for us, we've got excess furniture sitting in all the wrong places that had to be moved out of our donor rooms because, there are restaurants that can't fill tables if they could find the staff. But, it has implications, that people are left to their own devices on things that do, how far you stand in the supermarket is only one aspect of this. There are businesses that are making sacrifices based on guidance that's now roughly 2 years old, right? Well, a year and a half anyway. They need to update it. They need to put a logic out there to me and make it accessible. You shouldn't have to crawl around the website to find out the why of a decision. or a guideline. To me,
I just think it's been,
upfront.
it's been such a problem, with the twists and turns with this virus. It's hard to get hard and fast if you're always, you thinking you're okay, maybe we are on the right path, and then boom, here comes another variant or whatever that changes the tune. As David mentioned earlier, Delta, a lot different than the earlier viruses that we saw, different infectivity, all that sort of thing. It's kind of hard to say, okay, this is what we need to do, or this is why we're pulling back now, because it just seemed like we're been on the fly throughout all this. Maybe that should be better. I don't know. It seems different to me in comparison to some of the other things that we've dealt with over the years. It's not as I guess the predictability is, I guess, what I'm getting at. Where are we headed from here? Are we going to have another outbreak after Thanksgiving? Who knows? I don't know. We're just kind of wait and see type thing. And you'd like to be in a better position than that. But because of the nature of this particular bug, it's been tough to get to a solid place, and say, this is why we're doing it.
I want to give people grace that this is a new virus and it's evolving virus, but tell me what the endpoints are that you're thinking of. Social distancing will be de-emphasized or purely optional, or whatever language you want to put behind the off ramp to the recommendation. Just tell me, are you looking at death rate? Are you looking at incidence? What are you looking at? What's gonna be the guiding principle behind pulling back? And I'm willing to give you 6 months after some threshold. I don't want to fall into it. Once you lose the behavior, as we said, it's hard to reinstate it.
You can't get it back. Yeah.
Build an extra 6 months, but tell me what your thinking is. Again, leadership is about trying to map. It's not just about reacting in the moment to try to do the best you can. We're 2 years in, right? It's not like people are like, oh, well, we're all in the moment. Well, no, we're 2 years in.
And these parameters should come from CDC. Who's the leader?
I would favor, I would love them to convene an expert panel. They got enough time. It's not an urgent decision that has to be made. Let's bring in some,
good point.
And not just make it medical people. Let's have some heating and air conditioning folks in there, some ventilation experts, people who understand airflow. They probably have more to offer than most of the physicians.
Probably.
So,
by the way, I've got a something to throw up on the screen. We're talking about advice from people. Here's some advice from a listener. Let me put this over here. My husband and I are both vaccinated, have had our boosters since early October. We got lazy, haven't been wearing our mask. We both caught a nasty cold and were sick for several days for the first time in almost 2 years. Guess who's mask wearing again? Thanks, Brenda. I think the answer is Brenda and her husband. I will. And by the way, so here's something, a little levity. Are you guys familiar with Andy Borowitz, who writes for the New Yorker? He does the funniest stuff. Okay. And this is satire. So to make sure that you don't think I'm being serious here, it's satire from the New Yorker. Anyway, so this is what he said, what he's pretending from CDC. As an event dreaded by millions draws near, Dr. Anthony Fauci is urging all Americans to use COVID-19 as an excuse to skip Thanksgiving with horrible relatives. Speaking from his office at the National Institute of Health, Fauci said that COVID-19 excuse could help prevent a seasonal surge in exasperation and seething rage associated with the Thanksgiving holiday. Here's the quote. COVID-19 could get you off the hook this year, Fauci said. Consider this a doctor's note from me. Now that's messaging, right?
I'm going to target that messaging to certain relatives. I'll tell you that.
Just on the masking, I'll have to agree with the listener. I haven't had, knock on wood, I haven't had a significant illness since COVID started, and maybe I should be wearing my mask in gratitude for that, and not walking around stupid waiting to get hammered with whatever is floating around out there. But there are probably a lot of people who are in that same bucket of having enjoyed, better health probably over the last 2 years.
Yeah.
One of the things we were doing just before Delta did its thing 6 months ago was we were pivoting to other areas underreported, people not getting their checkups, disease, pre-existing conditions that people weren't taking care of, and then Delta hit, right? And that's where the doctors are saying to me, we need to be covering mental health. We need to be covering domestic violence, things that are not being reported. The study that CDC put out today, children and adolescents hospitalized with COVID-19 who also have underlying medical conditions like obesity and diabetes were at greater risk of being admitted to the ICU or needing a ventilator. And they're talking about vaccinations. But this is Diabetes Awareness Month. And
that's just one of many things. I mean, I think I saw something that Representative Bice put out a letter to the CDC raising some concerns about breast cancer screenings. And how lax we've gotten on those over the last 2 years. But the list goes on: colon cancer screening, breast cancer screening, routine maintenance of your diabetes, routine maintenance of congestive heart failure. I mean, the list goes on of things that have been neglected during COVID that need to be readdressed, that we need to catch back. We got some catching up to do still.
Oh, yeah.
Yeah.
Well, the headline, I guess, a few days ago was the 100,000 people who died of drug overdoses, the highest ever. 100,000, that's twice what we lost in Vietnam, in terms of fatalities, just a little bit under twice. And, that was 1 year. That's remarkable carnage. We lose about, that's 3 times what we lose to highway deaths. And we all fear highway deaths, pretty rightfully so, and are cautious around that. But that's a stunning number to me. And I hope it's interesting with a lot of the money that's being spent in Washington right now. It's interesting to me how little the conversation is around mitigation of some of the public health sequelae of COVID versus dreams of green energy and big hairy audacious goals. Well, hell, we have some pretty unhairy but or very hairy goals that are sitting closer to where we live.
Yeah.
Where's the money being pumped into the urgent response to the drug overdose crisis? And I guess it's baked in there somewhere. I don't know.
Doesn't catch the same sound bites, John. That's all there is to it. It's
a shame. It's a real shame that we've got these important catch-up work, as you said, and it's not part of the narrative of why we want to spend trillions of dollars.
Sure.
Stunning.
I think I can help you with that. If people will go to my interview from Saturday with Representative Logan Phillips. Representative Phillips is the point man for Speaker McCall on all the infrastructure money, which he also says they're going to be really aggressively going after in underserved areas, mental health, all of these sorts of areas. There's about a 4-minute interview. You go to news9.com/yourvotecounts. It's Representative Logan Phillips. Actually, I'm going to be playing some of the sound bites Wednesday night. And he really, really is talking about some of the things they want to do with this money. And by the way, one of the questions I had, doctors, was, do we have to wait for the legislature to get to town to appropriate this money? And he's going, nope. It's CARES Act money, ARPA money, all the things that they've already gotten and they're going to try to hit. For telehealth, for example, and Jeff Dismukes has been on here before and said, we can do some screenings, but you can't. I was in my folks' home, which is Garvin County. I mean, it's not exactly in the Ozarks. Right, nothing wrong with the Ozarks, but I mean, I've got the V word for cellular coverage. I couldn't get a phone call out of there yesterday. I'd use my folks' landline. It's unbelievable. I'm trying to show pictures. So when we start talking about broadband and just signals, Verizon's a big company. I love my coverage. Okay, but the problem is that in Lindsay, Oklahoma, I would have one of the walkie-talkies. I might do better. So there's these gaps all over the state with this. But anyway, go to that. It's news9.com/yourvotecounts, and you can hear Dr. Armitage. You can hear his answer to that. There is a bunch of money, as you say, baked into this. It is a bunch. He said he thought when this all began, the deliberations over this, there might be $40 million for Oklahoma. We're looking at right now $250 million in money coming to Oklahoma for that sort of stuff.
Well, I hope we end up with something better than TSET 2.
That's the thing. It's like, how much of the money is really going to go to what? I mean, I'm sorry. I'm maybe a little bit jaded, but I mean, how much of the money is really going to go to what it's supposed to go to? I mean, I think having broadband service, as a property owner in Murray County, I mean, I would love to have better internet service down there. But I think it would help a lot for some of these things we're talking about. I was talking to a patient of mine today who drives in every day from down in Frederick, and I'm like, why don't you just do telehealth with me, man? I mean, not every day, but every visit. It's like you're driving 5 hours to come and sit with me for 15 or 20 minutes, and he's like, dude, I can barely even get a phone call. Like you said, I can barely even get a phone call out of there.
That's crazy.
And so I think it's laudable that they're loading this money up. How long will it take? I mean, this is not something that's going to be.
It's not going to happen overnight.
Yeah, I mean, to lay down cable and to put all those. I mean, that is. That's going to be 10 years minimum before we start seeing. Right now, I'm getting 2 megabytes per second at my house in Murray County. I mean, it's going to be a long time till it's any better than that. That's not going to fix everything. But like John said, I mean, can we go back to what we know what works? PSAs about breast cancer screens, PSAs about colon cancer screens, PSAs about prostate cancer screens, PSAs about assessing your cardiac risk. I mean, go back to what we know works. People still watch TV. Use that medium until some of these other mediums might be up to snuff.
Or where's the mobile mammogram? I know those aren't the most cost effective sometime, but they certainly increase access. So, what's the math on something like that? But I would love to think that there's some epidemiologists who are advising on the spreading of this money. One of the problems I think is the people who are used to eating at the trough are just going to take another bite, and the ones who probably have never been used to being asked aren't going to be smart enough to put their snouts in. So a big risk, I think, that we end up with another low efficiency money dump that does some good, which is awesome, but doesn't optimize the taxpayer dollar. But I would love to figure out what, maybe when you have your next expert, Scott, you can ask them, well, what's the roadmap to get into the right answers? Who are the new people you're talking to?
Let me play a couple of clips from this guy. You asked for this. I think what they might do in terms with the money. So this is Representative Logan. These are short bites. I know we're getting short on time, but so Representative Logan Phillips, he is the point guy for the infrastructure. Former Signal Corps military guy, and was a career tech teacher. Signed up for the state legislature, ran against the sitting minority leader, and won. Didn't spend a nickel. So he's not exactly a career politician. I asked him about some of these. Let me hit this real quick.
All right, so it's worst kept secret in Oklahoma. The DOC facilities are really, really old.
Oh, that's prison. All right, here's the one I wanted. I'm sorry about that. Here's the one that I wanted as we were closing out.
Do we have to wait until the legislature comes to town to appropriate the money?
Absolutely not. We have an ARPA working group that's already been meeting. We have grant proposals already going in, and they are already in the process. I expect those initial grant proposals to start going out anytime.
Okay, last quick question, 5 seconds to go. Delegation was against this bill. Are you going to spend the money, though?
Every single penny.
I love this guy. I asked him 6 months ago. I said, look, every Republican member of our delegation is going to go vote against this money.
Right.
And he said, I don't care. I'm going to spend every nickel on infrastructure. And he's one of the most honest guys I know.
Well, it's encouraging. Obviously, he's got an enthusiasm to try and make government as effective as he can. It seems like from that, but that's a big lift.
It is.
Yeah.
Well, we're almost out of time, and Dr. Chansong got to go. We've got a lot of things. So if you have ideas, I mean, we're eventually going to be talking about something besides COVID. If you have an idea what you'd like us to cover upcoming weeks and months. And I think everybody's worn out. Worn out is the term, but we've got to get to some other areas where we have a lot of issues in Oklahoma that are just not being addressed. So send your suggestions to scott@mitchelltalks.com. I'll run it over with the doctors. Dr. Armitage.
I'm just worried about post-Bedlam depression. Half the state's going to be in deep trouble come Saturday. So how do we treat that? How do you find out if someone's suicidal after the game? What's real, what's not?
I thought I heard Dean say that I haven't, listen,
Oh,
we
God.
lost to the Vikings yesterday, for heaven's sake. Talk about depressed. So, but is it a possibility we turn right around and have another OSU game for Big 12 championship?
It's only the
Yeah.
only way that happens is if OU wins.
OU's
right?
got to win.
If OU loses,
OU loses, Baylor's got it.
If Baylor wins,
Baylor.
wins, yeah.
And Baylor wins, yeah.
I don't know who Baylor's playing. Do you know, Scott? That Blake?
I do not know.
I don't know
I hadn't heard on him.
I do not know.
But yeah.
Any last
We're
thoughts for Thanksgiving, doctors?
Enjoy your
Yeah.
turkey.
Enjoy it.
Thanksgiving. Hug
Happy
everybody.
Thanksgiving,
Last
yes.
year, and yeah, enjoy your Thanksgiving.
Yeah.
Apologize for the slur against Ralph Lauren and trying to give LL Bean a foot up. There's no reason to do that.
He already texted me. He's mad at you.
I knew he was. That guy. Okay. All right. Wednesday night, we have this interview. Also, this was interesting. I asked a few days ago, there was so much discussion about the jails, the jail downtown, the jail up in Tulsa, which hold a lot of people. I asked, could I go in there and have a look around? And they said yes. So I did that today.
Really?
Camera. I asked, who else has done this? And the folks down at the jail said, well, nobody. Okay. So I'm going to give you a peek as to what's going on down there. There's a lot of news about what happens down there, but here's a hint. A lot's going on down there. And of course, a few days ago, we heard there's discussion now. Looks like it's real probable that there's going to be a new facility in Oklahoma County to take care of a lot of the problems. But anyway, that's Wednesday night, 7:00 with Augusta McDonald. As we're going to do this, we may have the pumpkin pie out, but that's 7:00 on Wednesday night. In the meantime, Dr. Armitage, Dr. Chansone, Dr. Sublett, it's not like it was a year ago where they were saying when the CDC was saying stay home. But if you haven't got vaccinated, I hope you do. And because we saw what happened, RSV, be careful with those little ones. And we'll see you next Monday night. Thank you. Happy Thanksgiving, everyone.
Happy Thanksgiving.
Happy Thanksgiving.
Boomer Sooner.
Yes.
Yes, please.
Yes, please.